Non-small cell lung cancer is amongst the most common types of cancer, accounting for about 85% of all lung cancers. Cancer stems from DNA changes or mutations. Over time, accumulated DNA mutations in a cell can lead to uncontrolled proliferation and tumor formation. Although chemotherapy and radiotherapy kill some cancer cells, they often require additional agents to stimulate the immune system and mediate an anti-tumor response. Plinabulin is a novel first-in-class selective immunomodulating microtubule binding agent, SIMBA, which works differently than conventional microtubule binding agents. Plinabulin binds to a distinct site within tubulin and has different kinetics compared to other tubulin targeting agents, showing a preferential efficacy and safety in combination clinical trials. In dendritic cells, DCs, microtubule targeting with plinabulin reversibly binds a differentiated tubulin binding site, resulting in microtubule depolymerization and release of the immune defense protein GEF-H1 from tubulin. GEF-H1 release activates the JNK, Jun N-terminal kinase, signal transduction pathway to initiate cancer cell apoptosis and promotion of anti-tumor T-cell responses via dendritic cell maturation. Mutations in cancer cells result in foreign proteins called tumor antigens. The plinabulin-activated DCs present these antigens to CD8 T cells, which recognize them as foreign and attack the tumor. Non-clinical data indicate that plinabulin also kills cancer cells directly. These effects are thought to contribute towards the ability of plinabulin to shrink tumors and increase patient survival. Although chemotherapy kills cancer cells, it also causes severe neutropenia, an abnormally low level of specialized immune cells called neutrophils that are continually fighting infections in our body. In the bone marrow, neutropenia results from the depletion of highly proliferative progenitor cells that give rise to neutrophils. Chemotherapy-induced neutropenia, CIN, can result in febrile neutropenia, which leads to hospitalization and, in many patients, sepsis and death, making CIN the #1 reason oncologists modify chemotherapy regimens. However, relative dose intensity reductions can have significant negative effects on overall survival. Studies suggest that plinabulin ameliorates neutropenia by increasing hematopoietic stem cell numbers in bone marrow and through local IL-6 release, leading to mature neutrophil egress from the bone marrow. Plinabulin's mechanism of action is distinct from granulocyte colony stimulating factor, GCSF, the current standard of care for CIN. In combination, plinabulin and GCSF demonstrate superior efficacy for neutropenia. Importantly, an unexpected positive benefit of plinabulin is that it significantly reduces the bone pain caused by GCSF in patients. Plinabulin demonstrates benefits as an anti-cancer agent and a CIN prevention agent, showing great potential for the treatment of various malignancies.